On an Ebola vaccine that was turned down by the World Health Organization. It's now the best hope to deal with an outbreak. Where are we at with the vaccine?
Well, we're not there yet, but we are getting close. Finally, in March, GlaxoSmithKline, which had this Ebola vaccine, which had tested in animals, went to the WHO, the World Health Organization, and asked them if they would be interested in using this in this current Ebola outbreak. At that point, back in March, it was mostly isolated to Guinea. There's maybe about 86, about 100 cases. WHO said, that's interesting, but no thanks. We're focused on containment. We'll get back to you. And that was the end of that, the end of the conversation. Well, as we've discussed, the containment efforts did not work. This outbreak has spiraled out of control. And in August, the WHO was going back to Glaxo, the head of the WHO going to the CEO of Glaxo, urging them, please, we need this vaccine. Get this vaccine to us as soon as possible.
Why couldn't they do this on a dual track, the search for the vaccine and the containment?
The WHO was worried that it would divert energy and resources to focus on a vaccine which was unproven, and they thought they could contain this and that a vaccine was going to just be a distraction for them. But this Ebola outbreak has proved to be unlike anything anyone had seen in the past. And now, as we're talking about cases getting in the tens of thousands, possibly hundreds of thousands, containing that is almost impossible. So now it could come down to a vaccine. Glaxo is in the very early stages of testing it in humans to make sure it is safe and to make sure it triggers an immune response. And then by early next year, hopefully, they'll be able to get something to healthcare workers.
Is vaccine really the last best hope at this point?
Well, the international community is scaling up containment and response efforts. You know, Obama has pledged troops and money. The United Nations now has an emergency group on the ground. But the problem is that it still seems like no matter how much we ramp up efforts to control the virus, which is what we need to do to stop the spread, we need to quarantine people, we need to stop each infected person from spreading it to 2, 3, 5 other people. Every time we ramp up those containment efforts, the virus just spreads even quicker, even farther. We're not ramping them up fast enough.
You have a quote in your story. Peter Piot, co-discoverer of the Ebola virus in '76. His quote is, "It may be that without a vaccine, we really can't stop this epidemic."
That's a possibility. There's a fear that if we don't do something soon and something big, and the health officials and the folks on the ground don't feel we're doing enough yet, that this could be endemic in West Africa, meaning for years this virus is circulating around. Maybe it's not always 100,000 people at a time, but circulating around, always present. And the longer this is circulating in West Africa, the bigger the risk of it spreading elsewhere, which it already has tried to. And luckily, we've been able to stop it in other countries like Nigeria and even suspected cases in the United States.
Shannon, even if we do get a vaccine, I would imagine there will be barriers to implementing it.
Well, yeah, that's the ethics are one of the things that's being worked out right now. First, the idea is to give it to health workers so they can feel protected. Those are the people most at risk. Your last guest was just talking about how 10% of healthcare 10% of people who've been affected are healthcare workers. So getting it to healthcare workers, but then to scale it up, who gets the vaccine next? Are there concerns, ethics about testing in the middle of an outbreak in a developed country, making sure people are informed about that this is an experimental treatment and who gets it and how it's actually distributed?
And Shannon, just real quickly, the experimental treatment, is it going to be made available at any time soon?
Glaxo, if it is safe and effective in these early studies, they're hoping to have a few 100,000 doses in 2015. Johnson & Johnson's also working on a vaccine. By 2015, they could have hundreds of thousands of doses as well for theirs, too.